Good afternoon, everyone, and welcome to our last episode of the webinar series before the summer in our Cancer Survivor to Financial Survivor series. We are joined today by Jasveen Kaur and Jen Atkinson. So a little bit about Jasveen. She has been practicing occupational therapy since 2003. Sorry, excuse me. She has made a significant impact in the lives of countless individuals across various settings, both in the United Kingdom and Ontario. Her expertise extends beyond the walls of hospitals, reaching into the community to assist individuals in their own homes, social services, workers' compensation cases, short-term and long-term disability, and motor vehicle accidents. She's been an unwavering pillar of support for her clients to help them overcome the limitations of health conditions impacting their physical, cognitive, and emotional abilities. She has a compassionate approach and deep understanding for the impact of health conditions on a person's abilities to meet the demands of their personal and work life. Jasveen firmly believes in the importance of living a full and meaningful life, regardless of the obstacles one may face. Through her expertise in occupational therapy, she empowers her clients to regain control and pursue their goals, dreams, and aspirations. By helping them adapt to their new circumstances and providing practical strategies, she facilitates their reintegration into daily activities, leisure pursuits, and work environments. And a little bit about Jen is that she is a wife, a mother, an occupational therapist, and a breast cancer survivor. She has been working as an occupational therapist since 1994 in mental health internationally and in community therapy while she raised her two girls with her husband, Brian. While working as a palliative care coordinator at home and community care support services, she was diagnosed with breast cancer. Her journey through treatment and the rough road back to work was not an easy one. Always an advocate for occupational therapy, she asked for a referral to an OT as part of her return to work. She is now back to full-time employment, largely due to her positive experience with her therapist and the cognitive gains she made while in therapy. In today's webinar, Jasveen will cover the impact of cancer and treatment on a person's physical, cognitive, and mental health, and how an occupational therapist can work with the person to gradually overcome these challenges to return to work with or without modifications. The presentation will cover some case studies of past success. And then we will hear from Jen, who has experienced her own journey with breast cancer and how she advocated for herself and occupational therapy to help her return to full-time employment. So with that, I would like to pass it over to Jasveen.
Hello, everyone. Thank you for giving me this opportunity to be here today to talk to you all about returning to work after cancer treatment. As we all know, it can be quite challenging, and we are grateful to Canadian Cancer Survivor Network for giving us this platform where we can discuss these challenges and try to come up with some ideas, some solutions that can possibly be of help. So we will, in this presentation, we will explore how occupational therapy can help ease the transition from being a patient or being off work to returning back to work, or creating a path for you to return to purposeful work, and provide some tools for success. So why is work important? I think that's the most important thing where we can begin, because when we talk to people about work, we need to understand why is work important for people. It provides a sense of purpose, normalcy, and identity in the Western world, which can be essential during the recovery and survivorship phase. Returning to work can contribute to a renewed sense of self-confidence. We all sort of identify with our professions quite a bit these days. We have worked hard to reach at that level, to have those skills, to be able to contribute financially from the financial benefits of working. So it provides a sense of self-confidence and self-worth. It also offers social interactions and a support network beyond the healthcare system and beyond what your family is able to provide to you, allowing you to connect with your colleagues and build new relationships. Now, a lot of that changed in COVID, but I know it is starting to get normal with more and more people working out of their offices and attending meetings. So those opportunities are very important for recovery. Participating in purposeful work also helps in recovering a sense of authority and confidence in one's life after the challenges. It offers monetary stability, autonomy, and reducing the anxiety over all the expenses, medical expenses that one must have incurred while going through cancer, and it enhances overall well-being. So also we sort of are have this sense of expertise and wisdom through our working lives, and that can give us skills that we can use in our own recovery as well, just like resilience and have using those transferable skills from our work into our personal life to recover and to move forward. So different types of cancer treatment has different effects and life impact on people's life roles. So um, people undergo radiotherapy, chemotherapy, surgery, and the side effects are generally fatigue, cognitive changes, neuropathy, physical limitations. After the treatment is over, and whilst the treatment is going, when somebody is having active chemotherapy or active radiotherapy, there are other effects like, diarrhea, vomiting, nausea, uh, tiredness, extreme fatigue. So there's this whole side effects that people experience with the treatment, and that challenges them in their day-to-day activities, their ability to take care of themselves, to take care of their family life, to be like if they're a parent, a wife, or if they're a caregiver for someone else, all those roles can get impacted, as well as their social roles in the society or their work responsibilities. We know that many people have to go off work while going through treatment. And then the question is, how do they return to work after the treatment? How do we get to that next step? So how can an occupational therapist help you? So as occupational therapists, we have advanced training and understanding what are your abilities, what are you able to do for like all the activities, what are your strengths, and then use those strengths to be able to complete the essential activities that you have to do. So the first thing as an occupational therapist we do is we ask you, what is it that you want to do? So you might be struggling with personal care after cancer, or you can just take care of yourself, but you have no energy to take care of your household duties. Forget about going to work. So we will meet you where you are, where your challenges are currently, and then help you slowly, step by step, get to where you eventually want to be. So we always talk about these short-term goals, which are like for somebody who's very like acute, who's just had some treatment, we'll ask them for like maybe 4-week goals, then 3-month goals, then 6-month goals as to what would you like to be able to do in the next 4 weeks, and then in 3 months, and then in 6 months, and then we slowly take baby steps to help you get there. So working with an occupational therapist, the first step would be an assessment where we will look at evaluating your physical and cognitive abilities, uh, identifying what are your potential workplace barriers. We'll talk about work a little bit. If we are providing very much work-oriented therapy, we'll ask you about your job, what you do, what were the duties, what are your concerns about it, just so that we are aware of it. It's like you are trying to set a ship, put a ship out into the ocean, and you need to know the direction you're going in. So therefore, we would like to ask about that, and then we would take small steps in that direction. So intervention here, I have primarily talked about collaboration between the patient and the employer to develop a customized plan for returning to work. But I want to say that it will depend really on where you are. In past, I have worked with some patients who were struggling even with personal care. They could not even have the energy to have a bath every day, or to even eat meals properly, or to be able to even go out of the house or to the end of their driveway daily. So that's where we are going to start. And then our overall direction will be ending at helping you return to work. So we need to see where you are and we work from there. As part of our treatment, we will provide education, resources, and strategies to manage fatigue, cognitive changes, and contribute to your overall wellness. So the return to work process eventually will look like a gradual return to work. So I really want to emphasize this gradual return to work, because many people think when they hear of return to work, or they get a call from their disability provider or their employer about work, they think, oh my God, I have to return to work to like full-time hours, and I can't even get out of bed every day. I can't even shower every day. So they panic. So I want to reassure that if you if you work in the organized employment sector, most employers will allow a gradual return to work, where we will slowly build up your hours and abilities. So a few hours, a few days a week to full-time work over a 6 to 8 to even a 6, 8 or 10 week period, which will allow you to slowly get used to your duties as well as the hours. So the process all involves open communication between you and your employer, and the occupational therapist participates in that communication to address any concerns and to accommodate any needs. Along the way, we look at if there are any accommodations which are required on a long-term basis or a short-term basis, such as perhaps offering flexible work hours, modified job duties, and use of assistive technology to ease the burden of some of the tasks that can be automated or done differently. Uh, Fatigue is one of the major barriers for a lot of survivors. So we talk about techniques like energy conservation, environmental modifications, and rest, or pacing. So energy conservation is where we would ask you to break tasks into smaller segments, prioritize them, and do it slowly. So for example, many families, they save their laundry for the weekend, and then they have like 10 loads of laundry to do for the whole family, which can be exhausting. So the idea would be to do smaller loads throughout the week, so you don't get tired and you are able to get your laundry done while also not getting wiped out by it. Environmental modifications at office is generally the workplace, your desk and all, but also it can be other accommodation based on your specific job and what the duties might be. And we would accommodate rest throughout your day to ensure you have consistent energy levels and you don't get exhausted. Cognitive changes after cancer treatment, so not all patients report cognitive changes. It's important to realize that. Some do, some don't. So if you are feeling something, your occupational therapist can do a cognitive assessment to determine what difficulties you are having. And then they can give you exercises, compensation strategies, technological ideas to help compensate for that or to do things in a different way. And employers these days will be advised of those challenges, and then they can come up with ways as to how they can support you in returning to work. It's important to also realize that a lot of people feel that they are sick and why would their employer want them back? But right now, the way the market is, experienced employees are assets for the companies. They know the job, they have the experience, they know how to do it. So employers, in my experience, have been very, very supportive in accommodating those people back, because they know that with the right support, these employees are an asset for them. They know the job, and if they treat them well, they're going to be like on their side for a long, long time. So I think that's one barrier that people need to overcome. They need to stop thinking themselves like a burden or like no employer is gonna want them back. They in my experience, they have been very, very supportive. Emotional challenges come with the diagnosis as well as while going through treatment. And afterwards, people experience different types of emotional challenges. So psychological support through your treatment team or through your employee assistance program. Lots of local authorities also provide psychological support in terms of counseling or working with a psychologist, but also occupational therapists can help you with tools and techniques that will help you in goal focused work, as to, like, getting on with your life, returning to work, how to manage mood swings, how to get over uh, low mood, how to kind of have your goal in mind regardless of how your mood might be on a day. Like, basically keep going in the direction you want to go in. So your occupational therapist can help with that. And employers these days have employee assistant programs and other confidential services through which you can seek support if needed. So, navigating the emotional and social aspects of returning to work. So people know, from in my experience, I've seen that patients have factors within them that they are feeling, but they're also worried about how others would be perceiving them. So emotional aspects of returning to work include anxiety, issues with self-esteem, or fear of recurrence. This is quite big. So in treatment, we provide coping strategies for managing these emotional challenges. As I said, getting support from EAPs, support groups, reconnecting with colleagues and establishing a supportive network, and working towards self-advocacy and maintaining a work-life balance to support overall well-being. Fear of recurrence is also around, can be managed with understanding the reasons, if known, for your cancer, and knowing that, no, I've had a few clients who were quite worried about that my work stress caused me this cancer. I got sick because of work stress. And a lot of work was done just to understand whether there was a direct link or any direct evidence towards that, or whether it was perceived, and if that perception was really helping them or was coming in the way of them being able to return to work, and then refocusing their goals on what they wanted to do versus what could happen, which none of us can see. We don't have like crystal ball. So working with some of those strategies. Work focus wellness techniques. So we teach our clients to incorporate wellness techniques within their daily life as they are recovering and thinking about returning to work. So physical fitness, participating in physical fitness, to have like all components of stretching, strength training, cardio, improving your stamina for a well-rounded fitness plan. I use yoga as part of the treatment to kind of provide that movement-based meditative type of practice. So it gives the benefit of both mind and body wellness. As like outside of your workday and during your workday, we would encourage exercise breaks if you can, and relaxation breaks. Encouraging our clients to make time for nutrition. So like have time in your day where you can cook properly and eat properly throughout the day. So when people return to work, often life can be, if you're not careful and intentional, be rush, rush, rush. So how to avoid that and be intentional about what you need to do in your day to maintain health, which is to cook healthy meals, eat them at the right times to maintain your energy, as well as to prevent, any further health problems. And mindfulness is about mind-body health of your mental health, basically. So encouraging meditation, relaxation exercises, and stress management techniques. So working with an occupational therapist, they will teach you these techniques, and they will also teach you how to incorporate them in your daily life, in your week. So these techniques become part of your regular day, and you can fall back on them in times of stress. Because a lot of people these days know about these things, they can do them sometimes, but do they know these techniques enough? Are they proficient enough that if they're having a bad day or stressful day at work, that they can fall on them to be able to come to a relaxed state, a homeostasis that we call. So we teach our patients in occupational therapy to incorporate these basic elements in their day-to-day life. And yeah, thank you for your time. I will take questions in the end, or if anyone has any questions right now, I think in the end, yes. Thank you.
Well, thank you, Jasveen. That was great. We learned quite a lot about the process that way through your presentation. So now we will hear from Jen about her experience. So over to you, Jen.
Thank you. Hi, everyone. It's sort of weird being on Zoom. I suppose I should be used to it by now. I don't know if Zoom is a platform, but anyway, I'm speaking to, at this point, the masses. I don't know. Maybe there's thousands of people out there, but I don't know. My name is Jen. I am an occupational therapist. When the call came out to OSOT, which is my college, to say, you know, are there any OTs that work with, you know, cancer patients coming back to work and a return to work, I was like, well, I don't work with, you know, patients coming back to work after cancer, but I'm an occupational therapist who had cancer and then worked with an occupational therapist in a return to work. So my talk today is really more anecdotal, I think, and in just sharing my experience and how working with an OT was really valuable, and that I do hope that people do learn to advocate for themselves, because it is really important. So just to give you a bit of background about me, I graduated University of Toronto in 1994 as an occupational therapist. I started work, ironically, in hospital in anxiety management. So managing, teaching cognitive behavioral strategies about how you think affects how you feel. So I feel like I was well practiced with that, and I'm grateful for that now. Certainly, as Jasveen was talking about the emotional part of cancer and return to work, that was a huge thing for me. So having that fallback was really important. I went overseas and with my husband before we had kids, and worked in Kuwait for a couple of years, and then came back, continued to work in mental health, and then left to work in the community when my kids were little, so that I'd have a bit more flexibility. So I have a mix of working in a mental health background, but also in the community as an occupational therapist, visiting people at home. A lot of patients that were diagnosed with cancer, clients that were diagnosed with cancer, and as Jasveen talked about, you know, energy conservation, safety, what kind of equipment can be helpful for people who are coping with cancer diagnoses and dealing with fatigue and everything that comes with treatment. So that was my role for 16 years, working with a variety of people, sort of mixed bag of, you know, Mrs. Smith, who's 95, who falls, and, you know, a young cancer patient who's, you know, trying to navigate that world too. So had a really wide variety of experiences working with people. In 2010, I was diagnosed with Guillain-Barré disorder, which is an autoimmune disorder that affects your nerve function. And at that point, I was working in the community and I didn't have any benefits. So I was self-employed, considered self-employed. So I was actually back to work in about 6 weeks. And that was a real challenge. So in 2018, I decided my kids are older, I don't need the flexibility, so I'm going to go back, I'm going to apply for something with more benefits and things. And I'm really glad that I did, because I went to work as a palliative care coordinator, again, working with home and community care. A palliative care coordinator's role is with a lot of cancer patients, working as somebody goes through their palliative journey and then approaching end of life for these patients at some point, was my role, in helping to set up services for people at home, and really being a sense of strength, I guess, that having faith that I got you, you know, like I am going to coordinate your services, and I'm very capable, and I am able to separate my work life and my home life. So that brings us to 2018 when I started there. The pandemic hit, and everybody went home, and I, like a lot of other people, worked like I am right now, but I pajamas on, like you can only see this much of me, and most of my work was on the phone working with palliative patients, which was very difficult. But I became very unhealthy, and I gained quite a bit of weight, and I ended up going to my doctor because I had some shortness of breath, and because I am who I am, and because of where I work, I said to her, I have cancer. I need you to send me for all the tests. I know I have lung cancer. I have shortness of breath. So she said, well, I think you should lose some weight and we can go from there. So I said, okay, fair enough. So I actually started on a health journey, and I lost, some weight. Went back to the doctor, and I still had this shortness of breath. So she sent me for a CT scan. And this was in 2021, in March of 2021. So by April, or a little bit into May, I got the good news that I did not have lung cancer. So that was amazing. And at the same time, I got the bad news that you don't have lung cancer, but you have breast cancer. So that was a complete shock to me. It was absolutely not something that I was thinking of. So, and I'm sure a lot of people can relate to that. It's out of the blue, a shocking thing. So I stopped work immediately. I couldn't work, obviously. I think a lot of people that I met during my journey, they either had to work because they didn't have benefits, like I was, when I was diagnosed with Guillain-Barré in 2010. So thankfully I did have benefits and I was able to stop work, and I'm very grateful for that. And some people that I met chose to work. So because it was helpful to them and that they were able to do it during their treatment. I could not, because I just couldn't be a palliative care coordinator at that time. So I was able to leave work, and I had surgery, and I had chemotherapy, and I had radiation, and my journey, from diagnosis to completing my treatment was about a year. I developed definitely side effects from the treatment, and they needed to stop my chemotherapy, unfortunately, early. I didn't tolerate it very well. My heart didn't tolerate it very well. So breast cancer patients maybe can relate to that, or maybe that happens with other chemo too. I imagine it does for other types of cancer. But I had a lot of shortness of breath, a lot of fatigue, a lot of side effects that I was able to sort of manage, because I thought this is awful, but it's helping me. I think what I've learned from this is that overwhelmed should be a diagnosis. Stress to the point where you can't think should be a diagnosis. So I know Jasveen had talked about the emotional part of things, and I on the other side of it, now I look back and I see it's very difficult for any of your providers, your nurses, your therapists, your doctors, your social workers, all of those people. I was in that role. I am in that role. But until I was on the other side of things, it's really difficult to understand that sometimes somebody's saying something to you and you're staring at them and you see their mouth moving and you understand it, but you just don't get it. Like, you're so overwhelmed with the rabbit hole in the back of your mind that you understand what they're saying, but you have no idea how to do it. You have no idea how to put one foot in front of the other. And Jasveen, I think what she said was wonderful, is that therapists, occupational therapists, can meet you where you are and developing goals, even if they are literally like, today you're going to get dressed. And when that goes well, then you can do it again. Or, and then making that a bigger goal. But I think what I've learned is that it's so important for both sides to be really honest with each other, and for therapists or doctors to check in more. Do you understand? And for a patient or a client to say, I don't understand, because I found that was one of the biggest things for me. I knew I would be tired. I knew I would feel nauseous. I knew I would feel unwell. I knew my hair would fall out. I knew all of those things, but what I didn't really understand is that overwhelmed was the biggest thing that I felt, and that impacted all of the other things dramatically. And maybe that's not everyone's experience. And I was lucky enough to have my husband, my partner, and my grown daughters to support. But I worried about them. That was another thing. You know, overwhelmed should be a diagnosis, and worried about other people should be another one. So it's just funny, all of the things that I had written down here that I'm looking at. And as Jasveen was talking, I just thought, I can pivot, you know, and I did advocate for myself for an OT because I had Manulife is my insurance provider at work, and I was very grateful that they were involved. They checked in with me quite a lot. Obviously, their role is to get me back to work. I do understand that, but I wasn't offered an occupational therapist. I had a really good person working with me, but there was a lot of patient-splaining and occupational explaining. I don't know if anybody, you know, can get that, but I felt a lot of the time that I was being told that, yes, you do feel that way. You know, like yes, it's understandable you feel that way, but I wasn't offered maybe how to advocate for an occupational therapist. Nobody said that to me. So if you do have insurance coverage, ask about it. I think in asking and then being referred to an OT, that was the best thing that I did, along with, you know, support groups from Hearth Place, attending brain fog, you know, sessions through Wellspring. I had a blog through the Caring Bridge, which is it's an online blog that you can share your journey with invited friends and family. It's sort of like Facebook for cancer patients, if you want to put it that way, but it's private. And it just meant that I didn't have to share over and over again with well-meaning and loving family members and friends and colleagues. And so I could just put it in an online diary and people could read it and respond, but I was able to access it when I wanted. So all of those things were part of my journey back as well. But the referral to the occupational therapist meant that I had a directed, I was directed to a resource that turned out to be one of the best things that happened. And I don't know if Sabrina Anand is on the call right now, but she's my OT from LifeMark. And I saw her for, I think it was like 6 months or something, maybe for 8 sessions, and which was kind of funny because when I got referred, I was driving there and I thought, oh, this poor OT who's going to have to do this cognitive assessment with me. And I've been a therapist since 1994. And, you know, I just was like thinking, you know, whoever this is, I'm a therapist. What's she going to tell me that I don't already know? Oh my God, that was so dumb. I met Sabrina. She was fantastic from the beginning. She did an extraordinarily thorough cognitive assessment. She helped me to understand where my strengths were and continue to be, despite me thinking I've lost all of my skills. I can't work anymore. How can I can't even like make a grocery list, to be honest, without breaking down or without being short of breath and having to sit. And she really did meet me where I was. And she did advocate for me with my insurance company, and then my insurance company with my employer. And we developed a program that took me from feeling very overwhelmed and very fearful about not being able to do my job in any capacity to giving me homework that helped my brain function, listening to me about my fears and developing strategies to address those as well. And they did support my work that I was doing by myself, but she really was an integral part of me getting back to work and also to figuring out what I wanted. Going back to work, I was going back as a palliative care coordinator, which I just felt emotionally unable to do. I just felt that is not going to be good for me. I couldn't watch the news because for fear of hearing that somebody passed away from the same type of cancer I have. I couldn't, Olivia Newton-John died, and I only thought of me. It's very selfish. Cancer is such a all-encompassing thing that everything is about you, and you don't want it to be, but it is. At least that's from my experience. I can't speak to other people, but Sabrina helped me with understanding how to manage those thoughts and to function anyway, and to establish goals and to work towards going back to work, but also to share with my employer what I could and couldn't do. And also to understand from the employer's perspective what they're able to help me with, because they did want me to get back to work. And as a palliative care coordinator, I can't say I can't work with breast cancer patients. Like, that's not going to work. That's not something that the employer is going to be able to accommodate. And me being stressed about going back as a palliative care coordinator wasn't a disability. It was something that was stressful to me, but it was also my job. Like, that's what I did. But with Sabrina, with her help, my employer was able to help to guide me towards going back to work, but in a different capacity. So I left the palliative care team, and I'm a care coordinator in a different, with a different caseload. And I do, now that I am back to work, I do have people who are diagnosed with cancer, and I do also have palliative patients, but I don't do it all day, every day. And I am able to take care of myself at the same time in fulfilling a role that I love. It was devastating for me to leave, but it is what it is. So, sorry. See, 2 years on, I still can cry. But this is what I can't do in front of patients. You can't start crying while you're dealing with somebody else's pain. But that's where I was. So I left, and I feel so much better. I went back to work in September of 2022. I think, what year is it? Still have brain fog. I went from baby brain, but my kids are now 20 and 23 almost. So I was like, okay, I don't have baby brain anymore. Now I have chemo brain, and that can last for as long as I need it to. But I went back to work in September 2022 on a return to work. It was it was a gradual return. I too felt very nervous about not pulling my weight. I was very anxious about making sure that I was doing what I could, but knowing that I was not returning with full brain capacity. I just wasn't. So they really were helpful about easing me back in. And Sabrina was really helpful about communicating to my employer what would be helpful for me. Maybe not accommodations, but what is going to help this be a successful return. And my employer did want that as well. They were able to help me with the successful return, but the occupational therapy part was absolutely so helpful because they were a liaison, and they were able to share even test results that kind of went to the employer. Not test results. I mean, there's privacy issues, but I gave her permission to share what I was struggling with, and then they were able to help me. So, for example, I went back in a different capacity, covering care coordinators who are not working because they're ill or off, but they could place me actually in palliative care. If a palliative care coordinator was off, that's a team that I would be covering. So Sabrina was helpful in saying that's going to increase stress levels, and it wouldn't be a good return to work experience if Jen has to go back to a palliative caseload. So that was helpful. And then when I was back at work with her checking in, knowing that, she was there for me. And then she did discharge, me as a patient, as a client, when I was back to work full time in January. So that's where I am. That's my story. It's just crazy that as an OT to be on the other side, I can say from both perspectives that it's difficult to understand the other one. So communication, communication, communication. Be honest with your therapist, be honest with your doctors, because from the other side of it, they really don't understand a lot of, they might say, oh, you have nausea is this, and you're going to feel that, and all of that stuff, but the impact, you really can't understand it until you go through it yourself. So sharing is really important, and being honest with your providers is really important, because your insurance company, they will at some point want you to go back to work. I said to my insurance company at one point, I'm not napping anymore. And then immediately the return to work discussion started. So I was like, but my brain's still screwed up. Like I might not be napping, but my brain doesn't work. So that's when the OT got involved. But anyway, overall, I can't say enough. And yes, I'm biased because I'm an OT, but I would absolutely say if you have the ability to ask for a referral to an occupational therapist, do it. And advocate for yourself. I had to, and I'm an OT, and I just figured, people would be offered, but no, not always. So ask for a referral. That's me.
Thank you for sharing your story, Jennifer. I hear you. I would say that I just saw somebody today. They don't have cancer, but they came home from hospital after something major, and they don't have medications. They have no pain relief, and they're saying, how come I was not given anything? And I am pretty sure it was addressed, but what you talked about is the emotional overwhelm, where you are hearing and nodding but not really absorbing everything, and then you come home and everything sort of falls out, and it's like you don't have, and then you're like, well, nobody told me. But it's like you said, nobody understands. You are in that overwhelm and things start to fall off.
Yeah.
So one of the
My husband taking notes was very
things I
helpful.
often say, taking notes. That's what I was going to say. Everyone should have a notebook with them when they get admitted to hospital and consultant comes, nurse comes. Just take a minute to write it down, or ask them to write it down if you cannot. At least
Yeah.
you have it there and you can get back on it. The date, who it was, what they said. So there is some record.
Mm-hmm. Yeah.
Yes, well, thank you so much, Jen, for being so willing to be vulnerable and share your experience with us. And I think it was really great to hear someone who, like you're saying, has that dual side, someone who's experienced cancer, but also has that background knowledge about what they really should be looking for in a return to work, or even just care for themselves in taking care of what needs to be taken care of.
Mm-hmm.
So we're going to, with the time we have left, take some questions. So if you have any questions, please drop them in the question box on the GoToWebinar platform. But I have one for Jen while we wait to see if there are any that come in from the audience. Because you're not, well, first I'll ask you, you're not in like a traditional office setting, obviously, with your job.
I do work in an office, but I visit patients at home. So my role is both administrative, if you want to say an office based. Now I work a combination of office, home based office, and in the community in patients' homes. So I visit and care plan and coordinate services through home and community care directly with patients in their home.
Okay, so then my question is regarding the part where you're working in the community and in home care. Obviously, that's a whole nother level of return to work, because it's a very unpredictable environments, because each
Yes.
environment is different.
Yes.
What would you say was the number one thing that came from Sabrina, your occupational therapist, that really helped with that aspect of your return to work?
In my return to work, that was, I'm going to say that was probably less of the concern than my cognition. I think I was just overall worried about my cognition and my ability to do my job, which would include even finding my way to a patient's home. Like and then that does add a level of unpredictability. So, and not having colleagues there to turn around and say, what should I do here? It's me. It's me. That I'm in front of somebody. They're asking a question, and I might not be able to answer the question. My fears were really about me not being able to provide this confidence in myself and in the information I was providing. And that's the last thing that somebody who is ill and somebody who is experiencing a major mental health issue. I'd say mental health, but that's likely, a lot of people are developing mental health issues, but like the last thing that somebody needs is the stress of me not knowing what I'm doing or not knowing the job. So, sorry, I'm distracted because my daughter just came in. See, I get distracted still, but I'm telling you that I'm distracted, so you don't just know that I'm just not paying attention. I'm just distracted. So, anyways, so that's one of the biggest things that I've learned to deal with is to work on my cognition, to work on my abilities, but also to share when I'm struggling or to share with what's happening so that people don't make an assumption. Well, she doesn't care, she's not paying attention, whatever. I mean, I don't know what people would think, but if they know that I am going through something, and that's I'm an open book, which isn't always a good thing. And certainly my patients don't need to know about my personal life and my personal space or anything. So figuring out what to say and how to say it and how much to share was something that Sabrina did as well. How do I go back? Some people, they wouldn't want to share. They wouldn't want to share anything. And I completely would respect and understand that. So an OT can help to how to have those conversations, how to communicate effectively, how to communicate assertively, how to use techniques that you can develop with practice with your therapist. Sabrina and I actually practiced and did role playing, and those conversations that I was worried about, I was like, oh, I've already done this with Sabrina. So she was very helpful that way too. I don't know if I even answered your question, Lindsay. I'm sorry. See, I've gone all the way around.
No, I think you did, because like to know that there's not always a solid answer for every situation, but there are still techniques that are able to be supplemented in to at least reduce the stress of those situations.
Mm-hmm. Yeah, transferable skills, something that being able to effectively listen and take notes and ask for, wait, can we hold on 1 second while I write that down? I use that in the community with patients, at work, in my home life. My daughters and I now will have a conversation and we will literally come to a decision, and then when my daughter is sitting there, I will text her what we just talked about, and she responds, yes, I understand. Or we do that back, so that later on I can say, I don't remember saying that. Like as a parent, did we? I don't think I said you could do that. And then she'll say, yes, you did. Here. And I'm like, oh, okay, I shouldn't have said yes, but I did. So those are the skills, those are the strategies that Sabrina helped me. Maybe not Sabrina said, okay, do this, but she got me on that road. So then when I was discharged, I was thinking more about how can I do this myself? What kind of strategies can I use, like the ones that Sabrina taught me? Maybe that didn't work then, but it works now. And helping you to think differently so that you can establish things going forward through your entire journey, whatever it is, whether it's a cancer journey or whether it's just, stress in your life. Those skills are transferable. Those skills are things that they might be in the here and now, but let's say something happens down the road, you can pull out that tool again And I found that that was very valuable. So it wasn't just during cancer, it was, and for my family too. My family's benefited from the strategies that I learned because they're helpful for them as well. So, yeah.
Excellent.
Mhm.
And a question for Jasveen. So some people do have the luxury of being able to go back to their existing job prior to their needing to leave work. But would you say that there's a role for an occupational therapist in like a job search capacity? So someone who's trying to find a new job?
Yeah, I mean, it really depends on what the person wants to do. I have worked with some people who always knew that their job was not the right fit for them, for their needs, their abilities, their aptitude, their lifestyle, whatever, but they were doing it. And then cancer can be like this life turning event. So after they have recovered, they feel like they've got another opportunity to live. It's like rebirth, and they want to live it at their own terms. So they then want to look at what would be best for them. So certainly an occupational therapist can work with you to define your values, to determine what kind of lifestyle you're looking at, what are your skills and abilities, and what could be some of the matching jobs that are available in the market, help you with job searching, resume preparation, applying for those jobs, preparing you for the interviews. A lot of work has to be done on the mindset. So if you're looking to change your life, you first of all have to change your mindset. So all not always knowing all the answers, being okay with that. Like I haven't had cancer or brain fog, but I would say a lot of times I don't know the answer. So I say I don't know, and I'm okay with saying I'm going to find out and get back to you. So being okay with some of those skills where you're always learning and you never know everything, and trying to match your future state to what your skills and abilities are, what you want, how much money you want, how many hours you want to work, what you want to use your strengths, you want to learn new skills. A lot of it goes into it. So an occupational therapist is the best person, best professional to help you with it, I would say, because they are like regulated health professionals. They come at it from a perspective of client-centered practice. They're not going to push you somewhere where you don't want to go. They will work with you within all the parameters that will be best for you.
And how easy would you say it would be to include the accommodations that you know that you would need going into a new job? How easy would that be into including that in the job search process?
So that will be working. So we have this strength-based approach, right? So when we say we need accommodations, most accommodations come with a list of strengths. You have some strengths, but you need to do certain things in a certain way, and there are some things you cannot go or you cannot do. So when you're looking for a new job, you're going to look at the job description, the demands of that job, the hours, the lifestyle, the money, everything, and see how it matches with what you need. And then you try to get that match. So I think easy is not the right word, but maybe the right word is you have to find the right fit. And the work needs to be done at your cognitive abilities, your mindset, your physical abilities, your lifestyle, your environment. If you have young kids, older kids, you're somebody's caregiver, you need to make $3,000 versus $7,000. So all of that needs to be looked at.
All right, thank you so much.
Well,
So we don't have any questions coming in from the audience, so you both were very thorough. We do? Yeah, sorry. I guess I'm having a technical problem on my end. We do have some questions coming in. So our communications manager, Trevor, is going to hop on and ask you those questions.
mhm.
Hello, everyone. So from Sophie, I'm curious to find out more about supports that exist for people who are self-employed to access OT. Also, for those who are precariously or underemployed and may not have access to OT services through their work insurance, are there resources that exist or financial supports that are available through community or governmental programs?
So if I'll go first, and then Jen, if you think of anything, we can both take. So if someone doesn't have access to insurance, uh, are you asking specifically around returning to work or occupational therapy while you are recovering? What would be the focus of occupational therapy that you'd be looking at?
I don't think that there is a specific one, but if you could briefly talk about both points.
Okay, so if you're looking at support while recovering, you could potentially get some support from home and community care. They do provide occupational therapy. I used to be a home and community care coordinator, and I do work for a service provider agency, VHA. I used to work in Toronto Central.
Oh my God,
So
Jasveen and I are the same.
used to be. So there is some support available through these agencies. So certainly call your doctor, get a referral to home and community care, or you can call home and community care directly. So you would Google home and community care support services, and a phone number for your local home and community care office would come up. You would give them a call, explain them what you're having difficulty with, and they could tell you if they can help you, or they could put you in the right direction. So that would be while you are in treatment and seeking support with some of the difficulties with side effects of treatment. If you're looking at return to work, I'm thinking if you don't have benefits, maybe you are on Ontario Works or ODSP. And I know that these programs do provide some support for encouraging people to return to work. There is something called as Access Employment as well. So they are also running some sort of programs under an occupational therapist to help people return to work. Why the YMCAs also offer such services. So these would be some of the organizations that I think you could get support from. Yeah. If you don't have insurance, but your spouse or significant other does, sometimes you have some occupational therapy support available under extended health benefits that you can see access. Or if your insurance provider does not cover occupational therapy, you can go to OSOT's website and print a letter that you can send to your insurance to get some funding for occupational therapy.
Jen, did you have anything you wanted to add?
No, I think Jasveen provided a lot of resources there. Yeah.
Excellent. So that was our question from the audience. So I would like to thank Jasveen and Jen for joining us today and for your time and presentations. If you would like to keep up to date with our Cancer Survivor to Financial Survivor series when it comes back in the fall, you should sign up for our newsletter to receive notice of all upcoming topics. Also, don't forget that our webinars are recorded and then posted on YouTube and our Facebook page. So if you missed it, you can catch up there. And with that, I would like to thank everyone for joining us today. Have a great rest of your day, everybody. Bye.
Thank you. Bye-bye.